there's strong agreement on both sides of the aisle there. Now, with regard to pre-existing conditions, this is an issue that is very difficult, and many of us and our families may have been faced with it. I can tell you I faced it when I closed my medical practice because I had a health condition, an arthritis condition. And I went to the same insurance carrier that covered my small medical practice for 14 years and got the big red no. Can't insure you or your family. Now, that's frankly unacceptable. Now, what we propose is using risk pools, expanding these risk pools, and reinsurance. It's an affordable way to do it. It creates certainty for a family that's faced with this very difficult set of circumstances. Certainty is important. And our plan would not raise premium costs extravagantly, whereas the proposal here would raise those costs, and it doesn't really create the kind of certainty a family needs because there are waiting lists, and that proposal is only temporary to something else that we don't know what it's going to be. The other thing we do is we create a way for small business owners to actually shop and compare apples to apples. Transparency. And this is critical. Our plan does this without creating the kinds of restrictions that we see with the exchange process. And we agree that we have to eliminate annual and lifetime caps, so we have broad agreement there. So again, I think it's clear that the American people have rejected the bills that have gone through so far because they see increases in premiums for families. They see that it raises taxes significantly on families and raises Medicare to create a new entitlement. This doesn't really bring down the cost. This is really not the answer. What American families want is a common sense, step-by-step approach that will really lower the cost for families and small businesses.
All right.
I believe we have a duty to reform health care, but we have an obligation to get it right.
Okay. Thanks, Charles. We're going to go to George Miller, and if you want to respond to specific things that Charles raised or make some more general points, we'll then go back to a Republican. At some point in this discussion, and we're going to have to be a little more disciplined in our time in order to stay on schedule on this section. At some point, I'd like Secretary Sebelius, who is not only a former governor but also insurance commissioner, to address some of the issues that have been coming up around insurance and minimum payments.
Mr. President, I don't know if anybody's we're told of what the time limits are.
Well, I'm trying to be flexible.
I'm just curious but you've got a certain amount of time.
We've got about half an hour remaining for this section. So if people can keep their
thank you,
Mr. President,
points brief.
From the Senate, we have Senator Harkin and Rockefeller respond to the Democrats.
And I've got to listen. George?
Thank you very much. This issue of insurance reform is, I think, where most families intersect with their insurance companies, with the health security of their families. And let's start out with our commonalities in the bill that Congressman Boehner, Leader Boehner, offered on the floor. He agreed that lifetime caps should be abolished, that annual caps should be abolished, that young people should be able to stay on their parents' plan. I think it was 25. I think in your suggestion, Mr. President, it's 26. So there's that kind of commonality there. But we think that, and our bill goes further in some of the suggestions you've made in the interim since the House and Senate had passed these bills, is that clearly we think that preventative care should not carry a copay with it, that we ought to encourage people to get that kind of preventative care for themselves, certainly for their children. We allow the health savings accounts to continue. That's a variation on, as my colleague talked about, what they think insurance reform should reflect. Clearly now, when we see the request in California for a 38% increase, in Michigan for 56% increase, I think in Maine is 27% increase. You've suggested stronger language than we have in either the House or Senate bill. I think along the lines what Senator Feinstein has been talking about in terms of rate review. People are trapped in these systems. But the one area where there still seems to be disagreement, it was not in the substitute offered by the Republicans when we were on the floor, and that is this question of pre-existing conditions, because this is a real trap for families. either because you find out that you need to go to get care for a disease or an illness, and you may get a checkup and they may discover that you have arthritis, but you didn't disclose you had arthritis, so now that's a pre-existing condition and you may lose that policy. You may have to provide more. And the fact of the matter is, you hate to admit this at my age, but I sit here with 2 artificial hips, a little bit of arthritis, and I have a kidney stone. I'm dead in that insurance market if I have to switch policies or switch companies or look for another chance. Now, why should that be? Those hip replacements have been with me for 15 years, and I have no trouble. But it's a way of denying me care. And if you have acne, it's a way of denying you care. In fact, as you see from one of the Blue Cross companies here, there's 3 pages of things that will keep you out of care, will keep you from changing your jobs. And it goes on and on and on. With those, back pain will keep you, a pre-existing condition. Acne that I mentioned, a cleft palate that we talked about earlier here. What means that? So what does that mean when you want to change jobs? What does that mean when you want to start your own company? It means you go without insurance. Or you pay some policy that has a $5,000 deductible or $7,000 deductible. This is a real issue to American families. 56 million people right now have insurance policies where pre-existing conditions can knock them out at any given time. We know that 13 million people were denied coverage over the last 3 years because of pre-existing conditions. And so now you're trapped. You have a pre-existing condition. You can continue maybe with that insurance company if you pay more, but you can't shop in the marketplace for another insurance company. You can't go from Blue Shield to Kaiser because you have a pre-existing condition. You start to see the economic trap and uncertainty that families are confronted with. Now, the interesting thing was, during these negotiations, Senator Dodd and I worked very hard on these issues. Most of the business community signed off on getting rid of these pre-existing conditions, and I think that that's important for us to understand, that is what real insurance reform is. Should you still be able to charge women more than men? Should you rate based upon gender? To what extent can you rate based upon ages? What's the essential benefit that we're providing? We can all describe that plan that's really inexpensive. It just doesn't have many benefits that go with it for families. And so I think that this is a very important part of this discussion. I know and when I go home in my district, I hear about this from the people I represent. I hear about this from my wife, and she's talking about our kids and her friends and people she spends time with, how they struggle with these. And what we're really talking about is the manipulation to move people around within the insurance market. And yes, you can go to a high-risk pool. So yes, because you have a pre-existing condition, because I have 2 artificial hips, I can go to the most expensive insurance system in the country. I'm now in a high-risk pool, and I'm trapped in that high-risk pool forever. You can make it a high-risk pool among states. You can make it a high-risk pool among small businesses. You can make it a high-risk pool among large businesses. I'm still trapped in the most expensive insurance because of something that happened to me that I had no control over. I have a child with a cleft palate. I have a child with acne. How can this possibly be? Now, fortunately, in our discussions, as I said, a lot of the business organizations have agreed that these things should be phased out over time. Some can be put in right away, as it's not terribly expensive to cover people 18 to 26, and that can be done right away, and we have that commonality. So I would just hope that we would focus on this issue of what real insurance reform looks like with respect to the impacts on families and individuals as they try to navigate this insurance market.
Thank you, George.
Mr. President, we'll turn now to John McCain.
Well, thank you, Mr. President. Thank you for doing this. And I understand the 4 categories, but there's a big category that the people in my state and across this country are deeply concerned about. And that's not just the product that we are examining today, the 2,400 pages, but the process we've gone through to reach that. Now, both of us during the campaign promised change in Washington. In fact, 8 times you said that negotiations on health care reform would be conducted with the C-SPAN cameras. I'm glad more than a year later that they are here. Unfortunately, this product was not produced in that fashion.